Thank you, Mr. Chair and Ranking Member Cassidy, for holding this hearing. Before we begin, it's absolutely unacceptable that Dr. De La Torre has defied a subpoena from this committee and isn't at today's hearing. The American people deserve to hear answers directly from him on the horrific mismanagement of Steward Healthcare. Ms. Sprague, and to all the witnesses, thank you for being here. To our nurses in particular, thank you for what you have done throughout your professional careers. Nurses keep our healthcare system going, and they save patients every day, and they comfort patients every day. And we are very, very grateful to you. Ms. Sprague, I want to discuss your experience at Neshoba Valley Medical Center, which is located in Massachusetts, just about 10 miles from the New Hampshire border. And Southern New Hampshire Medical Center in Nashua, about 18 miles away, is likely to be one of the healthcare facilities that now has to absorb the impact of the closing at Neshoba Valley. When Neshoba Valley Medical Center announced abruptly at the end of July that it would be closing in August, leaving just a month for patients and staff to prepare for this massive change in their community, I am curious about what patients and staff at Neshoba were told in the weeks leading up to that closure.
From Steward Corporate, very little. We got the Warren notice that was sent to the M&A that wasn't sent directly to each of the employees because they don't have to if you're a part of the union. So that's how the notification came of the closure to begin with. That was on July 26th. On August 2nd, so 5 days later, we got, well, 5 business days, so a full week later, we got the first email from corporate, Octavia Diaz, that said, you know, pretty much, I'm sorry, like, you know, we tried, but we're going to close anyways. It's not our fault. Nobody bid, which everything was done in complete secrecy. They kept saying no viable bids, no, but nobody knows what that means or what that entails. And they just closed. We had a town hall meeting, which is like we did it by phone with our CEO, but even they weren't given a ton of information from corporate. And that's it. We never had another interaction from corporate to all of the employees, like that was sent to us. Everything's closed now. Some of the doctors have left, like the specialists, the endocrinologists have left. I know about it because I work in the hospital and I know like what's going on as being part of one of the co-chairs of the union, but I have never gotten a letter from the hospital saying that there's no longer a diabetes and endocrine center. So a lot of people don't know, you know, and I know that there's nothing in check for them and how they got here. I don't understand, because if I don't do my job, there is a very strict system that will pluck me out of practice to keep patients safe. So how private equity comes in and just can do all of this to all of these people with no systems in place, it's crazy to me.
Right, because patients are going to have to travel farther to receive care in our region. It puts a massive strain on nearby hospitals and local EMS, including, as I pointed out, in my state. Can you speak just briefly? I want to ask you two things. Talk to me about the impact that you have seen or you're hearing from your colleagues in the nursing profession on other hospitals in the region as they have to work to absorb hundreds of patients from Neshoba. And then also I understand that you all tried to push back and protest the closing, and I'm curious about how Steward responded to that.
Steward had no response to it at all. We never heard anything from them. They just went on with their day, and because I don't think that they care at all. It was of no consequence to them of what they were doing to every employee and every person that gets care at our facility, how it was at every level going to affect them. And people had no transportation, no way to get there. They had no knowledge of it. And I guess there's some helpline that's set up for, I don't know, a few hours a day, but I'm sure it's wholly inadequate if Steward is in charge of setting it up. And they just had no help and no time because they wanted to get it done in 30 days because then it's less debt, less money that they have to spend to keep this hospital open. So there was no time to increase the staffing for all the EMS, all the towns. Most of them have 1 or 2 ambulances, aren't staffed. Now their transport times are double, triple to get someplace they're out of service much longer, meaning that there's not another ambulance crew available for the people in that town. And most of them are also the firefighters. So now you don't have firefighters in town for that. And the other hospitals around are having to absorb the patients. Sure. And then as the employees who have lost our jobs, now we have to go work in that setting where they're overwhelmed because how far can we go? We're not going to drive hours and hours to go where these hospitals aren't affected. So now I have to go work in an emergency department if I want to stay an ER nurse, which I do, that's more overwhelmed than it was before. And so it's just so multi-layered that, and it's things you don't even think of. You're like, oh my gosh, even a month later, I'm like, I didn't even think of that. Like, you know, and they don't care that nobody in our area, 16 communities that are serviced, they have literally nowhere to go, and it will cost lives. And they know the state, and they know it's wrong, and they know that Steward lied about everything always, and they still got to just do whatever they wanted. I don't understand it.
Well, thank you. I'm over time. I want to just comment to Ms. McInnes. I had a question about how things have changed at St. Elizabeth's, and you've already answered that multiple times. But, Mr. Chair, as somebody with family in the Boston area, I just want to say that St. Elizabeth's used to have a reputation as being a wonderful, wonderful hospital, especially for moms and babies. And to hear your stories shakes me to my core. And I thank you for being willing to share it. I thank all of the panelists for being able to, as Senator Markey pointed out, be brave enough to be here today when the person who should be here today is not. Thank you.
Thank you, Senator. Thank you, Senator Hassan. Senator